Hi everyone and welcome back to my channel. My name is Kahina. I imagine you probably already know that if you're clicking on my video, but if you don't, my name is Kahina. I have systemic lupus and I have had systemic lupus for 19 years, and today I'm going to do a video on lupus and pregnancy. Now, I'm currently pregnant, which is why I've decided to do this video. I am 34 weeks pregnant now. I do want to put a little disclaimer just to let you guys know what we're going to be talking about. There is going to be some discussion of loss of babies, of complications for babies, miscarriages, and the potential risks of those when you have a pregnancy with lupus. All of that is going to be covered in this video, so if you are not comfortable with that, if you think that is going to make you feel upset in any way, then please don't watch it. I don't want to be upsetting anyone or anything like that, so I just wanted to make sure everyone was aware what we're going to talk about before I get started. If you are interested in other videos like this, I have done some previously on lupus in sunlight, what is lupus, that kind of thing. So I'll also link them up there as well so that you can peruse those at your own leisure. But yeah, if you're interested in this kind of content, feel free to subscribe, leave me a thumbs up, and also leave a comment below if you have anything that you are interested in learning about when it comes to lupus. And I can certainly make a video on that. I'm thinking of doing lupus and pleurisy next, so if you have any recommendations, feel free to let me know. But let's get started. So, lupus and pregnancy. Your first question might be, I have lupus, can I actually get pregnant? I'm gonna let you know that my big 34-week pregnant belly tells you yes you can, and you can go on to have a fine pregnancy. So in the past, women with lupus were discouraged from pregnancy, just because it can be dangerous for the mother, it can be dangerous for the baby. And just to make it clear, when I'm talking about lupus, I'm talking about systemic lupus in this video. The vast majority of lupus cases are people with systemic lupus, and it has the most impact on the body in total. It's the most aggressive form. So in this video, I'm going to be talking about systemic lupus. In the past, you would have been encouraged not to have children, not to be pregnant, and you can still use other options such as surrogacy, adoption, that kind of thing. But in the past 10 to 20 years, because of medical advancement and improved understanding of lupus, there is now no reason why you can't experience pregnancy if you so wish. Now obviously that is going to depend on each individual. I'm not going to say every single person with lupus can have children. That is just not going to be the case. It depends on what level of complications you have personally, but at the moment they will supervise you very closely. You will probably, along with your regular midwife and antenatal checkups, also have checkups with obstetric rheumatology. Let's try that again. You'll probably have checkups with an obstetric rheumatologist. So it will be either a rheumatologist and an obstetric doctor, or more than likely a rheumatologist who has knowledge in obstetrics, or obstetrics who has knowledge in rheumatology, one or the other. And then there might be an actual rheumatologist there as well to discuss. If you have other complications, such as I have heart complications, which I've mentioned in some of my previous videos, I also see the obstetrics/cardiology clinic. So when I go there, it's an obstetrics doctor whose speciality is cardiology and diabetes in pregnancy, and she's there along with a cardiologist, and they then make treatment plan treatment plan for me, and we discussed how to move forward. The first step is always and will always be plan. Now, you will have better outcomes if you plan. I'm just going to be honest. Now, I wouldn't say I didn't plan, but the timing, this all happened a lot quicker than I anticipated it would. So the timing wasn't quite right, but the best thing to do is plan. You'll have a better outcome. So you want to wait until your disease has been inactive for 6 months at least to reduce any risk of flare during your pregnancy. The more active your disease is before you get pregnant, the more active it will most likely be whilst you are pregnant. And you don't want to be having any flares. To be quite honest, pregnancy is hard enough on the body without you having to take into consideration lupus flares and that kind of thing. It's not really something you want to be happening during your pregnancy, so try and wait until your disease has been inactive for 6 months or longer. You want to make sure you're on a stable form of medication or therapy. So you don't want to have just changed medications last week. You want to be on that medication, know that's working and has been working consistently, and then you can go about having a baby. Increased disease activity can lead to flares, and this increased disease activity can also lead to complications. You're more likely to have complications if you have flares during your pregnancy. So the whole point of planning is to try and minimize that. And your last planning step would be, if your local NHS trust has one, which it should, see the rheumatology obstetrics family planning service, right? Similar to the service that will see you during your pregnancy, but they're there for babies and lupus, not just lupus. So you want to be seeing them 3 to 6 months before you get pregnant. So they will then look at any potential risk factors with your heart, lungs, kidneys, any organ involvement at all, and they might change your treatment. They might say we don't need to change your treatment. They'll basically make sure that you are prepared and that your body is prepared to grow life. Now, for me personally, that did not happen. I asked for a referral to that clinic, and quite frankly, I ended up seeing them after I was already pregnant. I was about 12 weeks pregnant by the time I ended up actually getting to the top of the waiting list. So, but if you've got that facility to be planned and prepared, that's not to say everyone is going to have that option, because sometimes things just happen. But if you can, you're better off planning and preparing. Now, drug therapy. Obviously, I said you want to be looking at a stable form of therapy or medication prior to the whole pregnancy thing. There are lots of medications which are used to treat lupus, which you cannot take when you are pregnant. Or for quite a lot of them, you can't take them whilst you're breastfeeding either, if you do choose to breastfeed. So I'm going to run through them all now. If you see me looking off to the side, it's because I've written them down. So I'm going to run through them now. Which ones you can't take, and how long before you should stop taking them, because they can lead to complications for your baby. So the first one is methotrexate. You want to stop that 3 months before you conceive a child. Cyclophosphamide, you want to stop that 3 months before you conceive a child. And myclophenolate, you also want to stop that 3 months before you conceive a child. So in the 3 month gap, maybe I can put them on the screen so that you guys can see them. In the 3 month gap, you want to be stocking methotrexate, cyclophosphamide, and myclophenolate. Obviously, talk to your doctor about this, please. Don't just take my advice. Please speak with your doctor beforehand. But those are the three that in 3 months you want to have stocked those. Rituximab and belimumab, you want to have stopped them 1 year before you conceive a child, which is why, again, the planning is important. If you've been taking rituximab, which I previously have taken rituximab, but I wasn't looking at having children at that time. I have taken rituximab before. You want to be stopping that a year before you conceive, preferably. So obviously that's quite a long time. That gives you loads of time to plan. But yeah, you don't want to be taking that, so you'll have to probably move on to a different form of treatment. And leflunomide and biphosphonates, you want to stop them 2 years before. So that is a very long time. A very long preparation time there. You want to be stopping those 2 years before you conceive a child. So obviously some of these medications will give you a longer lead time than others. Before I got pregnant, I had been taking methotrexate, and then we switched on to azathioprine, which didn't work out for me personally. And I think I've got a video about that, and I can probably link it in the corner. But yeah, that didn't work out for me personally. But azathioprine is fine to take when you're pregnant, and okay to take when you're breastfeeding as well, which is why part of the reason I had switched to it, in case I wanted to start having children based on 25 now, was looking at that kind of option. What I will do is I will link a website called BUMPS, which is Best Use of Medicines in Pregnancy, and that will have advice on all the medications you might be taking, so that you know if you need to stop taking them, if you don't need to stop taking them. Do not stop taking anything without going to speak to your doctor, but at least you can write a list of the ones you want to talk about, because there were other medications I had to stop. Also, you're not allowed to take any non-steroid or anti-inflammatory drugs. That means no ibuprofen, no naproxen during the whole pregnancy, which obviously we use as a form of pain relief for people with lupus. So that may cause you some issues, but you're not allowed to take any of those. So just bear that in mind before you get pregnant, that you don't want to be taking any of those. But it's best to speak with your doctor, and I will link that BUMPS below so that you can look up any medication that you might be taking. So you could also have some blood tests prior to being pregnant, and you would be recommended. This is because you will find out if you have antiphospholipid syndrome, which increases the risk of complications during your pregnancy. It increases your risk of blood clots, as well as preeclampsia, premature delivery, and it also increases your risk of stillbirth or losing the baby. So it is worth knowing about that beforehand. You might be able to discuss with your doctor ways that you can treat that and prepare for that. You can also find out if you have any potentially problematic antibodies. So you want to know if you're positive for RO antibodies and LA antibodies. I have RO antibodies, not LA antibodies. Basically means my blood is sticky, is the only way I can describe it. It's sticky. So that can cause problems for the baby. I will talk about that a little bit later on. But they can also treat it in various ways, which I will also talk about a little bit later on. But if you speak to your doctor beforehand, you can get your hands on these blood tests, and at least you will know beforehand, so you'll know potentially what options of treatment you might have to undertake to, prepare for that. There's also, as with all pregnant women, lifestyle changes you can make prior to becoming pregnant. Now, I became pregnant very fast, so didn't really have a chance to do any of that stuff. But there are generally the same kind of things that are recommended to all pregnant women. So you can take a supplement of 0.4 milligrams of folic acid. Obviously, if you didn't get a chance to plan and prepare, they will give you the folic acid anyway. Once you show up pregnant, they will give you a small dose of folic acid. You're also supposed to take this during the first 12 weeks of pregnancy, and it reduces the risk of neural tube defects. Then there's also obviously your basic things that you can do: stop smoking, cut out alcohol, take calcium and vitamin D tablets, and keep a healthy weight. So if you are classed as overweight, which I am, you could try losing some weight. You could try, potentially maintaining your weight, making sure you're not gaining any more. And I will include another link below on some tips on healthy eating and exercising with lupus, because obviously, as we're aware, these can be really difficult. And I will also try and make a video on those as well. You can also get any necessary vaccines that you might not have had, like MMR. If it is winter time, you can get your flu, you can get your pneumonia vaccine. They do offer you some vaccines whilst you're pregnant anyway. So whilst I was pregnant, I had flu jab and a whooping cough jab. But if you're not up to date on your MMR, it's good to get that as well, because that can cause some complications for the baby as well. So that's all the stuff you want to be doing before you get pregnant. Now, I'm aware not everyone has the option to do that before they get pregnant. So let's talk about what you can do during your pregnancy. During your pregnancy, there are many things you will have to keep on top of. I'm going to link the NHS Choices website, which will have all of this information about during pregnancy in general, which I'm not going to cover here because that would take forever. It's going to be about pregnancy specifically related to lupus. But what you want to be keeping your eye out for during pregnancy are flares. Now, lots of pregnancy symptoms are also the same as symptoms of flare. Your common pregnancy symptoms include constipation, cramp, feeling faint, feeling hot, incontinence, frequent urination, skin and hair changes, and varicose veins. Those are your common things. Now, a lot of these, if you look through that list, are quite common during flares. So it's quite easy to mistake them for flares, but you want to be keeping an eye out. And if you think you're in a flare, speak with your doctor, because they can check. They can do some blood tests, check for increased disease activity, that kind of thing, to help you out with knowing, because to be honest, everything feels like a flare because your body feels terrible. I'm not gonna lie. Like, everything feels like you're in flare. I've been lucky and I've only had a very mild flare so far. But yeah, there can be flares. The risk of flares in pregnancy is around 50%. So there's about a 50% chance that you will have a flare. These are mostly caused by hormonal changes during your pregnancy, of which there are so many. That's what they're mostly caused by. So this risk will depend mostly on your background with your health, and if you've had any prior lupus complications before, if you've got organ involvement, you're at higher risk of having flares. If your disease is more severe, you're at higher risk of having flares as well. If you've recently had high disease activity as well, you're also at a higher risk of having flares. And that also includes if you've recently made a major change to your medication, you are now at a higher risk of having flares as well. That's why they do recommend that you plan beforehand to minimise your chance of flares, as flares can be detrimental to your health and the baby's health. If you find yourself having a flare, get it treated as soon as possible. Call your midwife, call your rheumatologist, whoever it is you have on hand to call them. Explain what you think is going on, and they will probably bring you in as soon as they can, and you want to get it treated to minimise the risk of complications. Now, potential complications which can take place because of a flare or lots of flares, severe flares, include preeclampsia, which is high blood pressure in pregnancy, premature delivery, and small babies, so babies whose growth is restricted inside the womb, which can also happen if you smoke, so stop smoking, and that can eventually lead to stillbirth, and it can also increase your risk of premature delivery as well. So you really want to be keeping an eye out for that. It's important not to mistake lupus nephritis for preeclampsia, as the signs can be quite similar, but lupus nephritis is kidney disease, and if you have that, obviously you need to get that treated. Preeclampsia needs to be treated as well, but it's treated differently. But your doctor can do specific tests to check for that, so keep an eye out for that as well. And I'm going to link information about all of this stuff down below for further reading. So not when you have a flare, because there's no guarantee you will. I've had only mild flares. Generally my lupus has been pretty good, but if you have a flare, you want to be treating it with immunosuppression and steroids. Steroids are safe to take when you're pregnant, but you don't want to be taking like a super high dose, because that can also increase your risk of other complications. So steroids are actually okay to take whilst you're pregnant, providing there's no preeclampsia complications. Steroids should be okay to take. You can also take immunosuppressants. Obviously that depends on that you can't take everything that you would normally have access to during your pregnancy. You can't have no rituximab, no methotrexate. All of these are immunosuppressants. You can't have those, but you can take azathioprine. So they might start you on that, as well as that you can take hydroxychloroquine, and there are also other immunosuppressants that you can take as well. So again, have a chat with your doctor about it, and maybe come up with a contingency plan in case you have any severe flares. Many women find that their disease activity actually decreases during pregnancy. This is because your baby helps you out. The fetus or baby, depending on when during the pregnancy it is, will often produce beneficial steroids for you, such as cortisone and progesterone. So these can be produced by the baby, they travel through the placenta and go into your bloodstream, which essentially treats your lupus and can make you feel better. A lot of women actually feel better during pregnancy when it comes to lupus. Obviously you still have pregnancy side effects, but a lot of women feel better when it comes to that kind of thing. And this especially happens during the second and third trimester. So other not so nice things that can happen during pregnancy: blood clots. So all pregnant women are at risk of blood clots. With lupus, you're more at risk of blood clots, and with any antiphospholipid antibodies, you're at an even higher risk. So I'm RO positive antibodies, which means I basically had to be treated during my pregnancy from very early on with aspirin and subcutaneous heparin, which is a little injection. It's a little needle. In fact, I'll attach a picture of the needle here. Yeah, I've had to take that since I was about 12 weeks pregnant. It's a little injection that you give yourself into your legs or your tummy. Obviously the bigger your tummy gets, the more uncomfortable it kind of is in your tummy, I'm not gonna lie. But that often will start quite early on. If you've had recurrent miscarriages before, you may be treated with aspirin in your first trimester, and if you don't have antiphospholipid antibodies to prevent thrombosis, which is blood clots, and preeclampsia, you might be given aspirin anyway, just without the subcutaneous heparin.
Hi, editing Kahina from the future again. So this is a very abrupt place to stop the video, because I've not done no outro or anything. Well, I have done an outro, and you are going to see the outro, but the outro is going to be the outro I filmed at the end of the entire video, right? So again, the outro is probably not going to make that much sense, but there will be a part 2 which will cover all the rest of the stuff. So yeah, stay tuned for that.
I hope I've provided some helpful information here about lupus in pregnancy. If you have any other questions about lupus or recommendations of videos that you would like to see about lupus, please feel free to let that information be down in the comments and let me know what you'd like to see, and I will continue making these videos because I actually quite enjoy it. And yeah, feel free to rate, comment, subscribe. That's going to be all from me for today. So thank you very much for watching, and I will see you in the next one. Bye!